Hi, everybody, and welcome back to the Dear Asian Community podcast. As always, I'm your host, Josie, and today I'm here with Dr. Jackson. So, could you just give a brief background about yourself and where you work?
Of course. Hi, everyone. My name is Jackson Ng. I am a physician assistant here in California. I work in Los Angeles. I'm an orthopedic PA, physician assistant. My background, I'm a first generation immigrant from mainland China. And I came to the United States when I was 18 and I started in a community college as an international student. So my first career, I started as a chiropractor, and I was treating people with various pain, musculoskeletal pain in their body with chiropractic adjustment, tissue work, and then rehabilitation exercise. So that was my first career. And then after a couple of years of working as a chiropractor, I realized my knowledge and skill is not sufficient enough. I want to do more, especially I want to practice medicine and be able to treat more complex conditions, prescribe medication, and perform surgery. So I found PA profession, physician assistant,
Mhm.
and that will allow me to practice medicine and also learn to become a PA in like 2 years. And this is the shortest time for further training. So that's why I'm here now. I've been working as a PA for the last 14 years, and then I really like my job. I love the profession, and I enjoy what I do. The main reason that inspired me to pursue a career in medicine and also become a physician assistant
Mhm.
is because of my family. My background, I came from a family with multi-generation of doctors in my family. I have two uncles are doctors. One is pulmonologist, and the other one is a doctor of oriental medicine, acupuncturist. So the family influence definitely has to play a very strong role in my decision to pursue medicine. What really motivated me to enter the healthcare field is because the reward and the satisfaction that you can receive from this career, which is very unique. There's no other job can compare. I'm not talking about monetary reward in terms of money. I mean, of course, there are many other jobs can make much more money than us. But the job satisfaction is really come from your more of your a sense of achievement and a purpose, especially when like if you treat a patient fully recovered and after they send you like a thank you card, they will bring their homemade food to the office. They really appreciate your work. I think this to me is the biggest satisfaction I receive from this career. So that's the reason, I really I feel because you made a difference in someone's life, and that really changes everything.
Mhm. Yeah, for sure. I've interviewed a lot of people, in the healthcare field, and I've found it very inspiring that everyone likes to care for other people, not only their patients, but their family, as you kind of mentioned. Um, and so I was wondering, since you mentioned that you were originally a chiropractor and now you're a physician assistant, so what is really the difference between them? Like, would you say one was more difficult than the other, or could you share your thoughts on that?
Yes, of course. Um, Let me first actually give you like a very brief introduction what a chiropractor, a doctor, it's actually the title is the Doctor of Chiropractic. It's a DC degree. You actually go through, it's a chiropractic college, it's a 4 year full-time program. It is very intense. You study a lot of basic science classes, anatomy, physiology, microbiology, like pathophysiology, I mean, physical examination. The basic skills is very similar to the medical school, training wise. But on top of that, you also learn chiropractic philosophy. Chiropractic is believe in a holistic approach. So basically, you treat people as a whole person
Mhm.
instead of break them into different parts, to analyze them. So a lot of chiropractic philosophy is believe, your whole, especially your nervous system is a central controlling for your whole entire body. Your other organs, different system, they all controlled by the nervous system.
Mhm.
So by treating the nervous system to maintain the health of the nervous system, that will help you to overall improve your health and also help you to cure different disease you have. So that's the background, philosophy about chiropractic. Now, in terms of treatment wise, most of the chiropractic treatment is all hands-on.
Right.
So either do like adjustment, which is called a manipulation. So to restore the alignment of your spine and extremities, and also soft tissue work, like kind of like a massage, and also through a lot of physical therapy, rehabilitation. You teach patient stretching, exercise, change their lifestyle, nutrition, dietary nutrition advice. So it's a very whole, like I said, whole person approach.
Mm-hmm.
That's a chiropractor. Now, the the traditional Western medicine, we call it allopathic medicine. On
Mm-hmm.
the other hand, is more focused on system. They actually break down into different systems,
Mm-hmm.
body, wise, and then they have many specialists. Everybody is very highly specialized in your own field. You
Mm-hmm.
know, so yes, you get things in very detailed work. So when it comes to with especially when it comes with emergency, when there's a life-threatening emergency,
Mm-hmm.
or if there's some like severe disease or like cancer, something very detrimental. They do have, because the way Western medicine developed, they came out. I mean, they're all based on scientific research.
Mm-hmm.
So there's a lot of research, all the science, supporting medicine. So they have a lot of advance in terms of treatment options, technology, surgeries, by using surgical different skills to help patients. So I mean that everybody approach is different,
Mm-hmm.
but the goals, of course, is all try to get the patient better.
Right.
Um, so either, I mean, holistic or allopathic, I feel, to me, because I study both,
Mm-hmm.
I think the best way is to combine both sides together.
Mm.
As in terms of, like I said, you're not kind of tunnel vision. You see a patient as a whole person, and at the same time, so you're not only focused on their chief complaint, but also their overall well-being.
I
So
see.
that's kind of like a short version of the differences and common, in between the two. Yeah.
Mm-hmm. Yeah, that's very interesting. As someone who's, gone to the chiropractor, but also go to like Western doctors, it's very interesting to hear your insight on that.
Mhm.
Um, So I guess now asking more specifically about being a physician assistant. So I've noticed like in recent years, I feel like it's kind of gained popularity. Like a lot of people have been talking about, or maybe it's just me since I'm looking for a career to pursue in the future, but I've seen a lot of people are, looking at being a PA now. Would you happen to know why or
Yes.
yeah.
The reason, well, I started a career back in 2010
Yeah.
um, as a PA. I went to the school in 2008. At
Yeah.
that time, yeah, it's out there, but it's still not very well known.
Uh-huh.
Um, I think a lot of the reason to do with media exposure.
Right. Okay.
Um, because as a PA now, because the media, they talk. I think that like a U.S. House, U.S. News, they all like consistently like a rate, PA as like a top three career in terms,
Mm,
like at least in healthcare field. Um, Along the side with like a nurse practitioner.
mm,
The other one will be popular. I think, physical therapy. That's also another one alternative. I mean, in terms of the mid-level provider wise. Now, PA is very special as compared to others.
mhm,
Is As a PA, you train in all different, pretty much all different specialty, because you want to train as a basic, as a like a general practitioner, like a family medicine doctor. That the model the PA program use.
mm,
So after you graduate, then you can work in any specialty of your choice. Um,
mm,
as long basically you don't need a further training. You just follow your supervising doctor. So you
Hmm.
learn basically you learn on the job.
Oh,
So
okay.
that's why in that sense is you um a lot of PAs is and they after they graduate they work for a couple of years and then you gain pretty significant amount of clinical knowledge and then your capability to do your job is I would say not I would say almost as equivalent to a doctor, to a physician. Yeah,
Hmm.
as long as you know your boundary, you know your limit. Because of course we are not trained because the PA program is condensed. So you take a 4 year medical school education and then condense into 2 years. So everything is like a very fast paced.
Hmm.
Um, so you learn in a short period of time. A lot of knowledge, you just go through. Of course, you can't absorb everything.
Hmm.
So really, it's the your actual learning is I feel is after you graduate when you start work. When you start working and you learn on the job, and then you learn from practice. So
Hmm.
now, why it get too popular? I think many reasons. I think one is because the short. It's
Yeah.
2 years instead of 4 years, obviously.
Yeah.
And then so you graduate early, and then there's no residency. For a medical doctor, you have to go through
Uh-huh.
residency. It varies from 3 years to 6 years. So you
Yeah.
add all together, you're looking around like 7 to 10 years. That's a postgraduate school versus only 2 years. It's a
Yeah.
master degree. 2 years you get done and you come out, you get your license, and you can start work. At age of 24, 25, which is
Yeah.
very young. So that's why a lot of people now you're looking at career is it's a very good alternative to medical school.
Hmm.
So you spend less time pay less tuition. You start work early, and it's pretty good income. I mean, it's not, of course, it's not as good as a doctor, but
Yeah.
it's still reasonable.
Yeah.
So I think that's the reason. Yeah.
Uh-huh. Yeah, that makes sense. And that's good to
Mhm.
know. Is there any like advice that you would have for people who are hoping to pursue like a position in a healthcare field or as a PA in the future?
Mhm. I think the first, you want to try to find a job or at least like shadowing,
Okay.
either a PA or nurse practitioner or a doctor, or a physical therapist. I mean, some will work in the field. You shadow them, observe, and then ask questions. That's actually get a firsthand experience. Then later on, like once if you have the opportunity, then try to find a job in a clinic to
Mhm.
work either part-time or full-time, because that way you can get a taste of what the work environment's like, what
Yeah.
the working culture is like, working in the clinic, and also deal with people.
Yeah. Sounds good. So how would you say would be a good way to find those opportunities? Would you just have to reach out to doctors?
Yeah, networking, of
Yeah.
course. That's where you usually start first. You find people you know.
Yeah.
You can start ask your family, friends, whoever they know work in the medical field.
Hmm.
That's of course that's the first. And the second, you can ask your own doctor because
Yeah.
yeah, because they know you. You've been their patient for many years.
Hmm.
So they know you very well. And then if you just ask them, most of the doctors they will happily to have you to shadow them. So just don't be afraid. Just ask. Yeah,
Yeah.
most of the time you will get an answer yes.
Okay. Great. Yeah. I've actually never thought of asking my own doctor.
Hmm.
Um,
Yes.
yeah. Okay. Well, that's all the time that we have today, but thank you so
Mhm.
much for joining me and sharing
Mm.
your experience.
Well, you're welcome. Thank you for having me. Yes. I really want to, yeah, just share with whatever knowledge and experience I have. So to help, future, for other young people, if they're
Yeah.
interested in the healthcare career.